The importance of developing a treatment philosophy. There are two steps to doing this. The first step is for you to define success for yourself in your terms, and that becomes the target that you're aiming for. But if you want to have a bullseye, then you have to come up with your own personal mission statement. Now, how do I define success in my life as an 80-year-old? I have raised two children who are financially successful and spiritually sound. I have three grandchildren, but I must let their parents raise them and not offer unsolicited advice. I've achieved financial security, therefore I do not measure success in financial terms. I measure success by my legacy. I would hope that the inscription on my tombstone would read, "He made a difference." In the few years that I have left, my goal is to make as positive an impact on my fellow man as I possibly can. Now, the first mission statement I had was as a clinician from 1969 till I retired from practice in 2008. And I will offer the patient the opportunity to treat every functional tooth regardless of the severity of the disease. And this became the basis of the cases that I had in the Miller-McIntyre Periodontal Prognostic Index, or the MMPPI. And remember, a treatment plan is a journey subject to change when the circumstances change. It requires the flexibility on the part of a conscious and caring dentist as well as a trusting patient. And when you're going to treat a lot of questionable teeth, the patient has to buy into this and trust you. So this is a philosophy that I had as a practitioner. The mission statement changed when I went to the Medical University of South Carolina in 2008, where I stayed for nearly 10 years. In that, I came to realize that I'm an educator first and a clinician second. My primary responsibility is to teach my students to think and to offer treatment options. Again, to think, not just do procedures, but think how they might modify procedures to make the treatment as simple and as inexpensive as possible for the patient. Third, I will teach students to provide adequate information so that the patient can select the treatment plan that best meets their needs. And finally, as I retired in 2008, I've come up with a new mission statement now as a mentor. A mentor is an encourager, provides positive guidance. Third, will listen to you and be your friend. In other words, as a mentor, I have long-term experience, I have the knowledge, I have the wisdom that can help students, and also I have the passion for helping them. So, what is a friend? And this is modified from my friend Burns Landis. A friend will not lie to you. A friend will not betray your confidence. A friend will not play games with you. And more importantly, will tell you the truth. Because we don't need a friend that sugarcoats the truth, but someone that will tell the truth. And that is the most difficult of these four things to do. And Walter Winchell gave this quote, which is in my web textbook under quotes: "A friend is someone who walks in when everyone else walks out." And finally, you need to be humble, certainly as a clinician, certainly as an academician, and now as a mentor. And T.S. Niles said many, many years ago, "I'm just one beggar trying to show other beggars where to find bread." A few weeks ago, I presented a webinar to the periodontal residents at the University of Louisville, Kentucky, and asked them to come up with their definition for success as well as their mission statement. They came up with this definition of success. To us, success is knowing that what we're doing is helping others lead a better, happier, and healthier life. Very succinct, very much to the point. Good job, Louisville. Now remember, the success that we have here, or this definition, is the target, but the bullseye is the mission statement. and I think they did equally as good a job on this. Their mission statement so states, "Our mission is to provide individualized, ethical care to patients who present with unique challenges by providing a thorough education, prevention care, and quality treatment." Again, bullet 2, our goal is that our patients can maintain their natural teeth for as long as possible, as well as replace missing teeth with dental implants. Third, we will always place our patients' best interests above our own and explain all the different treatment options to the patient so that they can make an informed decision regarding their own health. Great job. And so let's go back to what I mentioned earlier and refresh your memory on that. Remember, a treatment plan is a journey, subject to change when circumstances change. It requires flexibility on the part of a conscientious and caring dentist, as well as a trusting patient. For you cannot accomplish what you want to do unless you are flexible, willing to change, and have a patient that trusts you. Hopefully I've given you something to think about that will make you a better practitioner, a better student, a better periodontist, a better dentist. Enjoy.